Hello, how are you? We are connecting right now, so I apologize for a little bit of delay. Um, Thank you for joining today. I'm trying to. So, welcome to our LinkedIn event today. I appreciate you being here. I'm Han Brown, the host of the Boomer Living broadcast. And today's LinkedIn Live event is the AI Frontier, the ethical and policy considerations for a healthier future. We're standing at a threshold of a new era shaped by artificial intelligence, a technology that, while promising, presents unique challenges from generating misinformation and increasing polarization to job displacement. The burning questions are: how can we harness AI's power responsibly? And what can we do to mitigate its risks? And to help navigate this complex landscape, I'm honored to have Dr. Leith Slates from the U.S. Department of Health and Human Services. So, together, we'll unravel AI's intricacies, uncover its vast potential, and try to carve a path towards a future where AI is a positive force in today's society. AI's influence spans multiple sectors, including medicine. It offers extraordinary potential, predicting disasters, detecting cancer with precision. But these advances underscore the need for thoughtful regulation and transparency, especially in healthcare, where AI's role is increasingly significant. With our society aging rapidly, it's critical to address how AI can serve our older adults responsibly and empathetically without compromising diagnostic accuracy or infringing on patient rights. So, we'll delve into these issues and much more today. So, as we embark on this journey, exploring the challenges and discussing the ethical and policy implications, and envisioning a healthier, more equitable future powered by AI, we welcome and encourage your active participation. So, let's get started. I'd like to introduce Dr. Leith. Dr. Leith Slates, whose life embodies resilience and transformation. His experiences have inspired a deep appreciation for grace, humility, and second chances, which shape his life and work. And believing in the power of love to dispel fear and nurture compassion, Dr. Leith sees AI as a tool that can reflect these virtues and create transformative change. So, Dr. Leith, welcome back to the show. We're going to do an audio for now until we both can get the video in place.
Good morning, Han. Thank you for having me again, and thank you for bearing with some of my technological issues this morning. I guess very appropriate for the topic we're speaking to. I will be on camera momentarily, and then I hope we can make that transition over. But thank you again for having me. Very happy to be here.
Thank you. Thank you so much. So, I'm also transitioning from video to audio right now, and I hope everyone can hear us. If you can hear us, can you please just put in the comment? And if you have any issues with the audible, let us know. All right. Okay, so let's dive right in. So let's kick things off with questions that's likely to be in everyone's mind. So, given the rapid pace at which technology is progressing, especially in the field of AI, so what is your personal view on this whirlwind speed of AI innovations? So, do you think that we're keeping up, racing ahead, or maybe struggling to catch up?
Well, I think in general, stepping back and looking at what's required for advancement of any any people group, any civilization, any nation, um, we need disruption, right? And disruption on its own is going to be difficult because it implies the need for change. And unfortunately, I think with AI, our preconceived notions of how quickly that change would come or how impactful that disruption would be have been, grossly undercalculated, right? So I think that when the theoretical impacts versus what's actually happening in reality don't match, that creates a reflexive desire to slow down, or just a reflexive desire to retain or regain some type of control, whether that's actual control or perceived control. So I think that's where some of the danger lies with where we're at right now. So I think that your original question with regard to too fast, too slow, just right, I think we're doing all three. And unfortunately, I don't think that they're all aligned on the same sheet of music with regards to pursuing a reality that leads to the ethical, appropriate use of AI with guardrails in place that protect us from a variety of the perceived threats and real threats, and also maximizes the goods that it could do, or the good that it could do.
Great, great. Thank you. Okay, so we're going to go through some very important topics. Um, so let's get started with chronic diseases. So when dealing with chronic diseases, it can sometimes feel like the disease is in the driver's seat. The daily management, the constant vigilance, well, it can be really tough. Perhaps there's a silver lining on the horizon, and that's AI. And it's not just about data or algorithms. It's about shifting the power back into the hands of the patients. So, Dr. States, can you tell us more how AI might help the patients regain some control in their battle against chronic diseases?
Well, so that's a really good question. I think you couch it from the right perspective of gaining control or that capacity of agency, of self-efficacy, right? The inherent capacity to be able to make changes in one's own life. So I don't think any individual or sector within, health or pharma or biotech would really, caveat AI as the only tool to use in combating chronic disease burden, either nationally, globally, in communities at the hyperlocal level. It's an augment to, but it certainly isn't something that's going to be a a cure-all. I guess a good way to look at this is from the standpoint of what healthcare is often asked to do at baseline, which is for a variety of issues that it has no business providing solutions for, it frequently is asked to do because the point of quantification in terms of tracking outcomes, whether that's morbidity, mortality, some type of granular lab value that can be tracked, are reflections of upstream issues that have created those health manifestations, whether it's a chronic disease, whether it's exposure to some type of infectious source, an environmental exposure. Um, and I think that where we need to have I want to call it a strategic pause for healthcare, is to realize that the greatest the greatest potential impact for AI is likely going to occur outside the walls of a hospital or a health system. And by that, I mean, if we can use AI to better create a built environment or recreate built environments or uh, more adequately assess poverty levels or address starvation, address malnutrition, address inequitable areas around criminal justice, things that lead to baseline stress, increased levels of malignancy, inability to buy the correct foods or have meaningful employment, to reduce recidivism, to reduce um, imprisonment to begin with, to allow for better capacity to care for that key transition stages in life, going from adolescent to adult, or from independent living to assisted living, or to assist the capacity to maintain an independent lifestyle for aging populations. I think that those are meaningful considerations that I hope are not lost on healthcare at large. And it seems that that's not the case, but there's always that risk that we develop tunnel vision by function of mandate or by function of reimbursement and payment that creates a sense that healthcare is supposed to be the agent to change all. But I think we just need to better engage. And this is a normal refrain that we'll hear across many issues in public health and health, is that we just don't speak well to other sectors of life. And that's partly because we don't go out of our own cocoons from time to time. And then
Mhm.
a part of it is we just speak a different language in general. So that's part of my hope around AI is that it can maximize the good outside of the walls of the hospital to improve quality of life and mitigate those occurrences that require us to have increased touch points later in life with the health system.
Great, great. Thank you. And also the idea of patients taking control, making informed decisions about their health, that's a future that we're all hoping for. So thank you. Thank you.
Yeah,
All right, so let's talk about the mental health. It's an issue that's very close to many of our hearts. It's
right.
often silent, invisible, and it can affect anyone. The sooner that we can detect and intervene, the better the chances of recovery. And the real game changer could be AI. It's not the potential, it's got the potential to step in early and to alter life trajectories and to bring back hope. So, can you share your thoughts on how AI could potentially be the beacon of hope in early detection and intervention?
Well, I think it does parse out in a similar fashion with regards to where we see the greatest impact for the amount of concentrated, I guess, AI utilization. Um, and while I think that, with with AI, the devil is obviously in the details of how the data is presented, how it's coded, what the algorithm or the ML developers are um, seeing as important, right? So a lot of that gets back to the demographic makeup of the teams. So there's a very human touch on AI, whether it have generative or if we have um, other types of AI that would provide some evaluative component to the black boxes that we typically see with with regard to like how did the AI come to that decision? Well, that's not easily discernible in some cases, and that is one area of caution where I think that the area of mental health, behavioral health, suicidality risk, substance use risk, the predictive aspects of it can be problematic with regards to what data is used
Hmm.
and then how that data is used. So while I think that there's a large capacity for it to impact those touch points where you would have more of an acute intervention or even some subacute intervention where you're hitting the mark before crisis sets in. Um, there is not, from my standpoint, a clear understanding of AI developers or just, entities that are invested in utilizing AI frameworks to apply to these types of problem sets. And one example I'll give is, Facebook and their approach to algorithmic development around suicidality risk prediction in social media. Um, the lack of willingness to be transparent with what data, how that data is used, what is going into the coding that leads to identification of one versus discounting of another. I think that there needs to be a bit more of a transparent and trust laden framework that allows for those types of sensitive touch points to be leveraged in an ethical way. And that's the big concern for me from specifically mental health is the ethical implications because it's a sensitive space. Being someone that has a history of a lot of mental health diagnoses myself, and having been on antidepressants and antipsychotics, having a history of substance use and being in sustained remission, it's a sensitive area where you are part of the agency and independence is not disclosing what you feel you shouldn't have to, and uh, there's a risk there inherently around these diagnoses because of what goes into making an informed decision. So you either want to have the right data or you don't want to have abstractions of unmeaningful data points.
Mhm.
So that's one concerning area I have. So while I think it has great capacity for good, that's where a slow walk I think needs to occur to an even greater degree than other healthcare application considerations.
Mhm. Mhm. Yeah, your comments brings me to the next question. Thank you. So when we think about the struggles faced by communities across the world, like you mentioned, substance abuse is an issue that often comes to mind. It's a very complex problem, one that destroys lives and tears families apart. And it's not just about the individual user. It's the impact reverberates through society. Perhaps AI could be on the horizon as the glimmer of hope. I guess, like you described, analyzing patterns, predicting outcomes, and offering timely interventions, this has a potential to intervene and be a game changer. Do you have others that you could add, Dr. States, whether, how this could be the light that AI might serve as for substance abuse prevention and treatment?
Well, I think, with substance use in particular, there's, if for anybody that's had a touch point as a family member or a person struggling with substance use themselves, or a friend, anyone that's close and has been exposed to what, you could distill down to a series of patterns and cycles that are evidenced over time, right? So it's one of those things that's kind of, it's a perfect example of pattern recognition. But I think that the patterns of use and the patterns of risk and the patterns of um, relapse or slip ups or increasing risk profile that would lead to some type of increased use or dangerous use or um, potential for overdose in the near future um, is a worthwhile endeavor. Um, in part because of those patterns and because of the things we see as well defined based on the literature risk factors for XYZ. So we've seen that with the ability to do some predictive modeling around 1 month risk of overdose after discharge. And using that in a way to help provide targeted increased utilization of wraparound services and plug in for support for whatever may be needed to provide that bridge to next step in treatment, whether that's, intensive outpatient, residential treatment, CBT, talk therapy, whatever the case may be. Um, so I think that there is a lot of value there um, to optimize what's already a overstretched and overextended infrastructure for behavioral health across the country. Um, with regards to, the implications for other um, stressors that are maybe further upstream, and now I'm speaking to things like ACEs, speaking to those things in childhood and adolescence that really do provide the backdrop and the foundation for many individuals' subsequent use. That I think the jury would obviously be out there, but I think it gets back to the broader implications for how can you disrupt generational cycles of trauma through a a mechanism that marries AI into improving our capacity to provide good governance as a nation or as a state, as a locality, as a municipality. And it's not an issue of, for me, it's not an issue strictly of health equity or anything like that. It's more doing doing right by the folks that are within your constituency. It's just doing the most good for the greatest number and maximizing that with the tools that you have. And if AI can be matured and leveraged in a way that does so, I think that would have downstream impact on the prevalence, um, the actual overall influx in the pipeline of individuals that may have a series of experiences that would facilitate or bring about the likelihood of substance use disorder or other associated mental health diagnoses.
Thank you so much, Dr. States. I like to acknowledge the folks that are in the audience. Thank you so much for being here. And feel free to chime in, introduce yourself in the comments. Let us know where you're from and what work you do. I like to acknowledge a few questions. If that's okay, Dr. States, maybe we can help answer this. Um,
Certainly.
One is from, I'm going to try to read this here. One is from Ron Van Bluis. He's asking two questions. Who should be the owner of the information? And what kind of value chain transformation do we need? Can you address that?
So, in terms of the owner of the data, that's always an interesting question, especially when you're potentially leveraging hyperlocal data sets. And I think one of the ways that folks can actually develop agency and buy-in is to be recognized as, the quote unquote owners of that data. And obviously there are a variety of barriers that come along with the custodial chain for data, right? So things like appropriate data use agreements or a burdensome look at MOUs or having some federated data stream that requires a data lake and who has capacity to query that and for how long and what are you able to utilize and leverage as opposed to what will remain redacted in PI in a PII format. There's, I think, a question of ownership also around the type of data that is used. So we get to things like public health data that's more population health in nature, or law enforcement data, which I think has a great capacity to inform the broader implications of AI and its utilization. But that gets to issues like, well, what if we ended up with something like predictive policing, right? So then I get, my spidey sense goes off and I get worried about things like, oh, Minority Report. And are we going to be in this type of police state where we have data leveraged against us? And I don't think that's too far afield. I mean, the AI godfathers that have spoken out recently about the terrors of and the likelihood of threat from AI, I think that it's kind of well placed with regards to the potential or theoretical risk of harm. At the same time, I'm cognizant of the fact that it does require a certain amount of data quality and volume to inform AI with the best chance to make an informed decision. And I know that sounds, like I'm giving AI consciousness, and I don't think that's too awful far off in the future. Um, but I do think that we need to be very careful around that question of ownership. But I think it ultimately reflects back on the need to have good data with the appropriate human touch informing AI capacity to identify patterns and come to decisions that align with what a reasonable, centered, holistic, healthy human might also come to the same conclusion on. And then the second question, Han, I can't remember. Can you remind me?
Sure, absolutely. So, Ron is asking, and what kind of value chain transformation do we need from linear economy to move or to more preventative with crossover finance? And how do we tackle parties who are not having a license to change?
So that's interesting. The consideration around the early adopters versus kind of the late or the hard adopters, the folks that maybe are going to be more standoffish and not willing to integrate or adopt uh, novel ways of applying AI in whatever industry they might be in. Um, Part of that comes through the need for governance and policy. And I think that's one of the obvious areas in the US where we've been behind. If we look at our counterparts that are in the EU and how they've applied the GDPR around their pursuit of a AI Bill of Rights, and then also is that can then relate and fuel and provide the backdrop for a more significant policy framing or other types of admin engineering controls that would maybe permit for a guardrail driven value chain that allows folks to find themselves with some type of ROI as these things are starting to be built out in different sectors. Because right now, I think the narrative is a little bit too nebulous, and we don't know enough about what AI is good for me. And so that kind of what's in it for me, I think is a bit absent because the narrative is just saying, oh, AI is going to change everything. It's going to be good for humankind. But without some capacity for the granularity of folks to see themselves reflected in it and understand the capacity for it to do good for them or for their company, for their startup, for their patient population, or whatever um, the group is that they are responsible to or accountable for, there's going to be a lot of difficulty in applying value across a supply chain or across an industry. So hopefully that's a helpful response, but happy to clarify further if there's a follow up on that.
Great, great. Well, thank you, Dr. States. All right. So, in the realm of healthcare, accessibility and inclusivity are two significant challenges. Everyone deserves access to the best possible healthcare, but yet disparities exist. There's social, economic status, geographical location, race, gender, and many other factors that impact the quality of care that one receives. So now, with the advent of AI, we're hopeful or we envision a world where healthcare is not only universally accessible, but also personalized and effective, I guess, regardless of one's background or circumstances. And through predictive analytics, personalized medicine, telemedicine. So AI has the potential to democratize healthcare and contribute where everyone feels seen, heard, and cared for. So now, Dr. States, how can AI work towards providing this quality health care for everyone, irrespective of their circumstances, and make them feel valued and heard?
Well, so when I hear you say democratize, what goes off for me is another D word, which is the disruptive one. So right, um, and where things are too disruptive too fast, I think when you especially have quite a few incumbents in a given field
Mhm.
that are accustomed to realizing financial gain through an established way of doing things, it's going to create problems. So I think that for AI, it's no different with regards to operating within a current insurance, pharma, healthcare delivery, and research industry that maybe we'll see some areas more responsive or receptive to, and we'll have those as kind of the early spots of maybe reflected gains. And one thing I could think of is the way you may have with patient flow, with the actual capacity to triage and better allocate resources at that first touch for pre-hospital care, acute care, even surgical delivery of services. So across kind of the fee for service, still framework, I think that you have a way to optimize there with the consideration around things like, one of the things for medicine that frequently gets brought up is like improved clinical decision support, right? Or improved capacity to uh, tailor a EHR for a given health system, right? Or having, your AI doctor working alongside your human doctor, and the argument that the two of them together are better than either alone. So there's some, I think, semblance of where you have those touch points at the bedside, right? To help improve, maybe not just um, outcomes with regards to a disposition or treatment plan and utilization um, medications and other resources that a patient might need, but also perhaps that could improve the capacity for trust in a patient provider relationship, to be a partnership, to be a bit more of a team working in concert towards a goal of health for that individual, right? And that's one of the things that we've seen, I think, that's been helped by tech in general and the advent of the internet and the capacity to work through issues on one's own volition, which was the asymmetry of knowledge in that patient-provider relationship. And now that that has been, I don't want to say it's not on even footing, because I still think there's a wonderfully great value in having a clinical practitioner um, that has been through clinical training and understands um, the nuances of what what the entire picture looks like of a patient's health, as opposed to getting the siloed lab test results, or the siloed result from a PHQ-9, or the siloed result from an imaging study. They can help, provide the broad strokes for a patient in that provider relationship that allows for kind of that true empowerment. Um, but I think that, there's also been a lot of power from patients taking agency and being able to research on their own,
Mhm.
because it's one of those things where, um, the rising tide, raises all ships. So if we have knowledge being available to all, then I think that helps bolster the trust, that bolsters the capacity to do good, and the capacity for us to have an effective utilization of what um, what has historically been a much more asymmetric interface. I think that's probably been seen, for our purposes, when we think of folks with neurodegenerative change and cognitive impacts of whatever insult, whether it's organic, if it's exogenous, something that has happened that has limited capacity over time, especially for aging populations. Um, the there's great utility there for AI to do good. And, one of the things I'm reminded of is, and we all saw the story last week with the gentleman that was previously paralyzed and has been able to work over time with the AI-driven development of the tech that's allowing him to, have this feedback where pattern recognition
Mhm.
allows for this tech to pick up on what the brain is saying. And you will move here, you will move there. It's absolutely amazing to me that this would have probably taken like a million postdocs working 4 years at a time in the past, and you have a capacity for a high volume of computing with the capacity to identify patterns and um, work through a very complex series of data points that allows for a tangible benefit to a patient. So that's one of the more impactful ones for me. I know it was just recent last week, but it's certainly one of those check boxes for, oh, look what it can do.
Mhm. Mhm. Absolutely. The healthcare experience that we are, discussing, it's not just about technology. It's showing empathy. It's humanity. Um, so thank you so much. All right. So I'm going to go on to the next question. The healthcare professionals have always stressed um, the importance of early detection and managing health conditions. Catching a disease in early stages often allows more treatment options and better outcomes. Now, with the power of AI and machine learning, we can analyze vast amounts of data and identify subtle patterns that might indicate in early stages of a disease, or even before the symptoms appear. So, this can potentially alter someone's life trajectory and making early intervention possible and increasing the chances of better health outcomes. So, with that in mind, Dr. States, could you elaborate what your thoughts are on AI could potentially alter someone's life trajectory through early detection?
Well, yeah, I think, there's certainly been, even in my experience over the last, 10, 15 years, seeing, and the example I might bring up is, in the area of radiology and some of the early um, observations, I think with a lot of skepticism that you could have pattern recognition utilizing machine learning and AI to allow for a consistently improved capacity to detect early pathology, whether it was an incidentaloma or you actually had a screening study that you were being seen for, right? So that's always the considerate, and this is also, one of the, I guess, the more apparent areas where you want to minimize harm, right? And that could be the screening test, because obviously false positives can lead to quite a bit of harm. Think of the controversy over the last 10 years around the age for mammograms to be conducted. Is it 50? Is it 40? Why do we have a varying level of support or distrust based on um, uh, uh, whichever professional society or the USPSTF is chiming in on? And one of the things is, it always takes data time to mature,
Mm-hmm.
and there are different ways that data can be interpreted, obviously, and there are different conclusions that will be drawn based on, you know, methodology, sample size, power, statistical significance, all, the variety of things we use as clinicians, researchers, scientists to make these informed decisions about what can be done with a research classification or with a clinical diagnosis, right? A clinical test. Um, and I think that there's a obvious utilization um, in the early diagnosis um, for a variety of conditions. The one you might think of in a more concentrated way or focused way, rather, is something like cancer across the board and the capacity to do a high throughput screen for variety with a single test, right? So something like Grail, that's currently being evaluated with the National Health System in the UK and in England, and I think that it has the absolute capacity to, and it absolutely will disrupt our screening paradigms for disease. Um, to go from looking at a single cancer at a single point in time, at a single age range. Um, and I'm thinking of something similar to the way that USPSTF, the recommendations typically will come out, and other professional societies as well. Um, I think that it will change the way we fundamentally think about our screening programs and public health approaches to cancer diagnosis, treatment, prevention, and it already, I think, has started to do so. So things like, the cancer moonshot that have that's come out, and um, well, I guess I shouldn't say come out. I think, it's, redoubling efforts, providing a renewed focus with the understanding that things have changed, that treatments are being developed, and they're being developed much faster, that diagnostics are being developed and it's being done much faster, in large part because of, I shouldn't say large part, but an increasingly informed and matured by machine learning and AI. Uh, and whatever um, outputs we see in the near future for a variety of medications or tests or devices that are being developed, increasingly there is an element that's informed by that increased capacity for computing, pattern recognition, and then operationalizing those observed effects.
Thank you so much. I'd like to acknowledge the folks that are in the audience. Thank you for being here. And if you have any questions for Dr. States, please feel free to put it in the comments. And also introduce yourself. Let us know where you're from and what interests you of AI, and have you had success with that. So, the technology that's been gaining considerable attention is AI chatbots. These
Yeah.
digital assistants have the potential to revolutionize patient care, providing round the clock support and answering queries and even helping with initial diagnosis. So, with any new technology, there's some concerns. One such concern is privacy. Given the sensitive nature of healthcare data and ensuring privacy, it is huge. And the challenge we face is finding a balance between the exciting potential of these chatbots that it presents and the necessity of protecting patient data. So, in this context, what do you suggest? Like, how do we navigate the difficult balance between innovation that AI chatbots bring to healthcare and then also the privacy concerns that it presents?
So
What's your
that's
thought?
a yeah. So the application of these chatbots in a clinical setting has been, I think partly um, comical in terms of some of the, the observations. I think there was a piece in JAMA that looked at patient satisfaction with like their after visit summary letters or like a letter from providers, and these chatbot generated letters being received more favorably than the actual ones that were written by the doctors.
Hmm.
Um, and that might be a more levity laden example, which I think uh, you know probably demonstrates some of the utility. But I think that by and large, um, with these chatbots, it gets to that question. I think I mentioned in my previous response when I was talking about the white coat doctor versus the AI doctor, and them working better in tandem rather than isolation. And I think the risk that is run is that a chatbot becomes an exclusive, it becomes a surrogate in its entirety. Um, for a touch point with an actual human provider, in any variety, right? NP, PA, DO, MD, right? Um, there still should be that leveraged touch point that allows for communication and feedback that is fundamental to that provider patient interaction. But I'm not so naive in my approach that I think that there could not be applications that would be inherently um, useful to workflow management, to delivery of care that would not compromise patient safety, and you could retain patient privacy, respect HIPAA considerations. Um, but I think it's a very difficult series of critical touch points that need to be managed well before anything like that would ever be rolled out. Um, so I think that while it's possible, um, I would hope and think that that's not likely in the near future.
We have a question from the audience from Logan. Does AI and chatbot functionality further complicate, hang on here, the let me WebMD my issue instead of going to the doctor notion?
Yeah, I think So I think that's always the so where there is increased agency and command of literature and understanding, I think there's probably a good back and forth that could occur from that like chatbot functionality and capacity to um, if it's a and where we get to the issue of, well, determines what is a verifiable or judicious AI interface. So where are the good chatbots? Where is the bad chatbot? Because you may want to utilize the good chatbot to verify some things you may have gleaned in research from WebMD or from Google, whatever the case may be. Um, and that I think gets back to the one of the other considerations, which is okay, if patient X does a Google search and they find something out, and they have, let's say they have 40-pound weight loss over the last 6 months, unintended night sweats, and they're otherwise becoming cachectic and not really sure why. For many providers, we would have alarm bells raised about some type of malignancy or potentially even an infectious process. So there might be, public health issue at play there. So let's say that all this chatbot, was schooled on was to think of malignancy, malignancy, malignancy. This patient decides, you know what, I don't want any parts of that. I'm not going to check it out any further. While all along they had, pulmonary TB, or maybe they had some other type of disseminated TB where it was actively transmissible and now they become a public health risk. Well, who's responsible for the lack of an informed AI chatbot? I, I don't know. Is it the company? Is it, the provider not having been nice enough that the individual didn't want to go see their primary care doc? Um, I think that that's one of the other issues is around the accountability for AI when it goes wrong and when it goes well. So hopefully that was a little bit of an off the fly example, but hopefully that resonated well with some folks.
Yeah, yeah. Thank you so much. We have another question from Dr. Douglas Du. What do you see the FDA's role in AI? I guess, however you define it, regulation as to both indications for use and associated warnings for product labeling.
Yeah, so I think that's interesting, especially around the idea of tech as a medical device, right? So there are certainly defined implications where FDA would likely or potentially have some regulatory reach. By and large, I don't think that they should be shouldering the burden of primary um, federal engagement on policy or regulatory stances on AI broadly. And part of the reason I think that is, I think something that I mentioned earlier is that, you know, I get this sense, at least from much of the government standpoint, that, many of the examples frequently cited because they're the ones that have the greatest touch point with humankind is healthcare. So many of the political considerations that are driving the optics here are around healthcare, and inevitably the FDA gets implicated in these things. And while they have a few novel areas where they will need to and have started to chime in, I think Dr. Califf actually provided a interview, was it WebMD or MedPage, one of those earlier this week, looking at some of the implications for AI and the FDA. Um, the other piece where I think that it shouldn't, well, I guess the added thought around if it's not just the FDA, then who? I think this is where Congress comes into play, and there needs to be a uniform buy-in or something that's more than just a fear-driven, oh goodness, we need to do something about AI. There needs to be an intentional, thoughtful um, organization around next steps that has, funding behind it, a research agenda that informs a policy development, even lessons learned application from the EU, and what can we be doing that adapts for best practices here in the US. And I know that the White House has taken steps to make that at least a step towards reality. Um, but until, the proof in the pudding being from Congress around it, I think that's going to be something that it will continue to be a difficult issue to parse through for the FDA because the FDCA can't handle everything.
All right. So, Dr. Douglas Dew, I hope that adds some thoughts to your questions there. Now, as AI further integrates into healthcare, the key question is, so how do we ensure technology is primarily serving people? Well, AI can drive significant efficiencies and advancement, but there's a risk that it might be misused for exploited or profit, possibly affecting patient care negatively. And I guess we have policies and regulations guiding AI's ethical use, prioritizing patient welfare and preventing misuse. Um, so, so we're moving towards safeguards required, setting safeguards that's required for ensuring AI acts as a force for good and doesn't widen the existing healthcare disparities.
Hmm.
So, Dr. States, how do we ensure our policies prioritize people over profits and safeguard
Oh,
against?
that is a okay. Well, then that so we can step back and take a look at the whole health system, right?
Hmm.
And this I think gets back to an area where I believe that the vast majority of people in positions of decision making authority and power over time have not been overtly out to create systems that created inequities, disparities, um, a greater likelihood of one group suffering versus another. But there are, we are humans, and we do things in certain ways, and we don't necessarily do them consciously, whether it's an implicit bias or there's some other driver that really creates a situation where once the snowball is in motion, it just continues to pick up speed. So I think that that's the risk we run with AI, right? One
Hmm.
thing I've said in the past to colleagues is, AI through machine learning has, and the generative learning is it has a capacity to reflect the best of us and the worst of us, and so much of it in its capacity to do good or bad is going to be found in the foundational elements of what it's learning from. And if we have processes in place that have propagated or perpetuated inequities and disparities, it's going to, I think, despite our greatest efforts, find a way to reach those same conclusions to a greater degree, unfortunately. So, with regards to the potential safeguards there, I mean, you know, effective governance doesn't come through just a series of rules, right? Um, it has to come through the thoughtful application of trade-offs in what demonstrably provides value and where there's demonstrably a risk that's either acceptable or unacceptable based on the potential for good. And the maturation of AI and its further incorporation and extensive, more extensive use by many other touch points across the health system um, needs to be couched in a series of administrative and engineering controls that allow for intentional adoption of what we would, I'm not going to call it a utilitarian good, but I think where it is able to drive towards the greatest, creating the greatest opportunity for good outcomes, right? Because when it comes down to it, all we can get people is the opportunity. All we can look for populations to do is have the opportunity. We can't. necessarily manifest the good, right? I mean, there is
Mhm.
an element of action and agency and ownership here for individuals and communities and for nations to do best with what they have.
Mhm.
Um, the other consideration I have here is, oh goodness, it left me. I hope it comes back to me because I thought it was going to be a good one. Let's go to the next question, maybe if
Sure,
there's
sure,
time.
no problem. Well, like you said, we hope that AI will not only enhance healthcare provision, but also spark radical change in how we approach health and well being. So, let's say, looking to the future, what's your greatest hope for how AI can transform the healthcare system for the better?
Ooh, that's a also very tough question, but a really good and meaningful one, right? Because I firmly believe that if we just have a have a series of goals in mind based on what we view as possible, we ultimately don't get as far as we could have. Um, some of that is not believing in what we bring to the table. Some of that is not necessarily believing in the good that others bring to uh, bring to the table. But I think that when I look at hope, um, some people think of it as a um, unnecessary or ineffective way to approach problems. But I think it's really kind of the only way to approach a problem because it allows you to have the problem set based on what folks can do outside of your own self. Because I think that, when it comes down to it, that's kind of what hope is. We can
Hmm.
believe in ourselves a lot, but hope is, something that looks outside of ourselves into others, right?
Hmm.
Into other entities, into other ways of thinking, into something that we have to release our ownership of and our own capacity to create good or change. So when I think of hope, I think of what we all can do together, right? So my hope is um, that when it comes down to it, that this doesn't become a polarized issue, that it's not something that will be weaponized, um, that it's something that can be rallied around for what it is, um, and not as a fear-driven paralyzation that just sees us sit by the wayside or wait for something else to happen that drives us to be reactive as opposed to reactive or as opposed to proactive. That's the lesson that I think has been learned so often in healthcare and in public health is the inherent bad outcomes that result when we act out of reactive fear. Call it we could look at the opioid crisis, opioid epidemic. We could look at things like how cannabis uh,
Hmm.
legislative efforts or scheduling efforts have been couched over time in the war on drugs. Um, if we can kind of hope for the best in others and see ourselves as kind of a partnership, and by
Hmm.
the example here I'm making, it's the federal and the state governments, right? Um, where we all have our inherent value and good. There's something we bring to it that the other does that we do not have, and that the other does provide. We
Hmm.
get to a much better reflection of what an appropriate steady state with effective governance looks like at the end of the day. So that's my hope for AI. I know that's a little bit more broad and outside of the health spectrum, but I think that's the only way we get to a space where we effectively have a landscape that allows the health system and public health systems to mature in AI in a way that's healthy with governance and ethical considerations that really reflect the collective desire and meaningful pathway to go forward.
Hmm. Hmm. Thank you. Thank you so much, Dr. State. We have a question from Logan. How can Should AI be used in healthcare to drive transparency for consumers, or does AI further complicate transparency based on each organization using AI differently? Do transparency and AI correlate?
So I think they have to correlate. Um, and to be successful, I think that transparency is an absolute necessity to allow for adoption across a large swath of the population, right? To maybe get to that critical mass, as we might put it. And I'm thinking of like the late adopters, the hard adopters. Um, some folks will obviously just jump headlong into this thing without any skepticism just because of the potential for good. But I do think that, and we've seen this in, Congress, and we see it in opinion polls that have come out, or maybe even just the reflections that they comment on from some of their constituencies, that I think absolutely is a need for transparency, if not to bring folks on board, but to allow for the continued effective growth and understanding of what AI informed tools can be. Because some are going to be quite limited in their AI ML utilization, and some will be, largely driven and have great impact based on those informed decisions that they're coming to. So as it relates then to kind of equity across, the consumer space, I think that the transparency is huge. With regards to, safeguards for consumers. So thinking of like the CFPB, the consumer, CPFB, protect. I'm messing up the acronym, but the Consumer Protections Branch, and even folks like the FCC. There are very clear considerations there that need to be adhered to and met and likely developed, because there's not a great capacity for policy in this space at the moment. And that's partly because we don't know what we're getting into, right? It's hard to create policy for something you don't understand.
Great. Thank you so much. So when we're talking about mental health care, we're venturing into something very sensitive territory, and it's kind of an area where we need to tread carefully, especially when we're talking about bringing AI into the mix. So it's not just about getting the diagnosis or the treatment right, it's also about making sure that we're respecting people's privacy and trust that they're putting into the system. So, on top of that, we need to think about how this might change the dynamic between the person and their therapist or doctor. So, I guess, in your opinion, what are the key things that we need to keep in mind ethically, when we're thinking about using AI in mental health care? And what do we need to be careful, given the complex and the sensitive of this field?
So first, let me apologize for the sleeping bulldog in the background if anybody heard a snore. Second, I think that it's interesting with regards to the mental health considerations specifically, right? And some of that I think is going to be evidenced, and maybe in a smaller part with regards to telehealth utilization for mental health delivery of care. That's the one area of telehealth utilization that is very clear in the data, that there is there is parity with, or there is superiority to the in-person mode of delivery for mental health care. And some of that can be because it allows for greater utilization to decrease on stigma for, we could think of LGBT populations that maybe are a little less willing to be seen in person because of fear for, either hate speech or stigma that they're feeling in the office. There is I think, an equal consideration around, outside of the delivery of care for these routine touch points with mental health, whether that's, just straight talk therapy or being part of group therapy sessions as part of a substance use program. There's the acute interventions, like we were speaking to with regards to suicidality prediction and intervention, and how that could be implicated ethically with regards to respecting an individual's autonomy. That also gets to, what is another kind of mission creep issue of harm to others, right? Um, and this is not necessarily the clinic touch point, but this is the other areas of life touch point that have intersections with mental health and behavioral health, which is a very sticky issue that I'm quite concerned about, because I have the feeling that we're going to make some mistakes before we see successes. And it would be much better, obviously, to be intentional, proactive, and develop a system with safeguards in place that is informed by best knowledge at the moment, as opposed to waiting for something to go wrong, which is what I think we've seen with the way social media and these predictive practices have been leveraged for other touch points through social media, right? So whether it's targeted ads or misinformation, disinformation, there's a lot of potential for bad, and I have a feeling that it's going to equally be manifest before things get better. So that's those are my two concern areas there.
Thank you so much. All right, so we have a question from Nina. What practical steps can we as individuals take to ensure the responsible and safe utilization of AI in our everyday lives?
So it depends on AI at this point. I think this just maybe do not understand where AI has had some impact. I mean, most of us probably recognize the way that we are approached through our devices is not without, a large imprint from an AI feature that has learned based on us, right? So we're the we're those individuals. We're the data set. Like, we felt
So, Dr. States, your audio, y- yeah, I'm so sorry. Your audio is dropping.
oh, did it drop?
I'm I'm so sorry. The
Let
last
me chime in here,
minute,
Han. Can you hear me now?
a little bit better. The last 1 minute, it was dropped. So if you don't
I'm
mind,
sorry.
just go back to the question, or we'll wait for
Sure,
you. You
sure.
can be in a better position.
No, I think what happened is my AirPod probably died. So I apologize for that.
Oh, that's okay. It's perfect now. Sounds great.
Okay, wonderful. What I was saying was that I think that the greatest capacity for us to do good around our current touch points with AI is in our contact with our devices, right? So the the capacity to be aware of and to understand that that landscape is not, you know, something on equal footing, that we are in what I would call, you know, a more asymmetric landscape, as it were. We aren't in the EU where we have GDPR protections, where there's a bit more of a capacity for government or for other entities to bring folks that are accountable for those applications to a uh, uh, to a point of being held accountable for wrongdoing or misholding or mistransfer of personal data and use of that data, right? So that's the greatest space, I would say. And while we have, you know, engagement with AI tools at the level of the health system, I don't believe at this point that's where I would have my most care or concern. That said, I do think that we have obviously an increasing capacity for things to go wrong within those systems, and I think that it's partly due to the existing landscape of ransomware attacks, things that are already plaguing, you know, data systems and infrastructure and health systems. So that just lends itself to all the more need for cybersecurity CIOs at health systems and institutions to be quite wary and interrogate with, you know, a great level of scrutiny the systems they bring into their institutions.
Great. Thank you so much. So let's dive into a topic that's really at the forefront of modern healthcare: personalization. So this term has become a bit of a buzzword across many sectors, but when it comes to healthcare, it's not just a passing trend. So we have unique bodies, health histories, unique health needs, and our healthcare experience should reflect that individuality. But we find ourselves in an era where technology, specifically AI, making personalized healthcare more attainable. So it has the potential to tailor treatment plans, predict health outcomes, and even communicate health information in a way that resonates with unique patients. It's a powerful tool, and it needs to be handled with care, balancing with personalization, with individual privacy and preferences. It's a challenge, and I guess we have to navigate effectively. So, in this context, could you share your perspective on how AI can be used to make healthcare more personalized, and then how can we improve patient experiences and outcomes? Um,
So, it's funny, the whole area of customer experience, human experience, I mean, that on its own as a method to improve patient satisfaction, patient engagement, patient utilization of care and outcome and health outcomes is, it's, I don't want to say that it's well established, but it's used in a variety of sectors, right? Not just health, right? And I think it's been done for good effect, either with a variety of outcome metrics, whether that's the bottom line for something like IBM or some other provider of a customer interface. Could even call it Epic, Cerner. They all have their capacity to leverage data gathered from those touch points with the customer, and to inform that in a way that hopefully does more than just line pocketbooks. And I think for the vast majority, there's a focus on that in terms of creating good in workflow, for creating good in the backstops that allow providers to do their best work with the best information, right? Because providers, we are fallible. We have knowledge that goes out of date. We potentially will miss things based on exhaustion, because of overwork, because of burnout. So there is some inherent good there that I think will be married well to support patient autonomy and overall health. One thing that is of concern, I think, is the way AI might drive and change the workforce landscape. And the reason I say that's important for patient experience and outcomes is because of the potential to impact diversity of the workforce, whether that's through um, the uh, the manifestation of implicit bias that is already inherent in a hiring practice that allows for that to be steeped even further through the initial screen of applicants. They missed this buzz term that's not necessarily used widely, or there was something that it just went missed or went unregarded as a potential bias when the original algorithms are being developed by the team, by the AI team or the ML team. So I think that those are a couple considerations around customer experience, and then the
mhm,
kind of that human experience model in general that I think are important.
Great. Now, as we integrate technology into healthcare, the way we work and the skills that we need are changing. And it's not just about creating or implementing the technology, it's also about preparing the workforce to use it effectively. And healthcare is multifaceted with professionals ranging from doctors, nurses, technicians, administrative staff, and so forth. And each role might interact with AI differently. And the benefits of AI in healthcare are huge. To unlock these benefits, it's important that the workforce is adequately prepared to utilize these tools. So this involves not just the technical skills, but also understanding the ethical implications and the potential biases in AI. like we discussed, and also the ability to combine AI insights with professional judgment. So, what steps could we take to get the healthcare professionals ready for this AI revolution and making sure that they're equipped with the skills and understanding to make the most of AI?
So this question always makes me chuckle because I remember when I started off my medical career in the Navy as a medical corps officer, and almost all of the notes I wrote in my first few years of practice were paper notes, um, which I subsequently had to transfer to, an EMR or scan and upload. And there was nothing efficient about the process. And actually, the first, electronic medical record I used was something called CHCS, which was a DOS-based format, and it's still in use today in the military. And I think, so the thing for me that comes to mind, considering, that was just, that wasn't that long ago, is
Hmm.
the capacity for the workforce to change, right? The capacity to adapt and see themselves in this system's change. And that's where I think a lot of the drop off comes in the way these transitions are handled.
Hmm.
And for folks that are on the call that are engaged and have experience with these EMR, EHR transitions, a lot of the times the things that go off the rails is that the team bringing in the EHR is a group of well-meaning data scientists or informaticians that hasn't necessarily been adequately informed by all provider groups, right? If you build it based on making doctors happy, the nurses are going to be unhappy. The techs will be
Hmm.
unhappy. The EMS folks will be unhappy. There is going to be some loser always if you have one group always winning 100%. So
Yeah.
allowing for a mutual buy-in and bringing folks along slowly is, I think, abundantly important, and giving them the time to see themselves in the change, right? To see that there's some worth in this for them. And that's just, motivational interviewing. That's just behavior change observations in general. That's for anything, right? It's that if you try to pull people along with a stick, I mean, they're going to buck and push back, and if they're unionized, well, then you're dead in the water, right? So
Hmm.
there are there are a lot of, I think, very sensitive considerations that go into making a workforce proficient in an area that we're asking them to change to. So the existing workforce, I think those are some of the considerations there. For the developing workforce, for the pipelines, I think that there's an absolute need to increase the curriculum requirements, the training requirements. And I'm not saying if there's anybody from like ACGME or AAMC on this call, I'm not saying add more curriculum requirements that just add check boxes to getting people through the pipeline and training. I think there need to be, cross-cutting considerations around where there could be augments in text for existing touch points in curriculum that are helpful to improve um, competency, to improve comfort with these discussions, and then, actually having the capacity to relay that information to patients in a way that builds them up and creates a sense of empowerment instead of fear. That's always the problem of delivering something in doctor speak or in provider speak and clinician speak rather than in plain language that makes sense. So I think those are some of the more, I guess, uh, frequent observations and conversations I have with colleagues on my side.
Great, great. So we're going to take one last question as we're getting closer to the end. This is from Linda. Is there harnessing AI to improve and optimize alternative treatment suggestions? There are so many ways to harness data information. Breaking down the topic, deliverables could help everyone better navigate considerations and development of operational framework governance. if you will. This is from Linda. Could you take that one?
Sure. Well, I'll do my best with it. Thank you, Linda, for the question. So, you know, alternative treatment options are always a sticky area, right? In large part, I think there are a few considerations that might be germane here. So, as a first response to that, what I think is the spirit of the question, I'm not aware of any available tailored platform that would inform those types of discussions with regards to an alternative. So something outside of the pure evidence base, right? What I do think has started to happen in a variety of spaces, and I might use the example of traumatic brain injury. That's an area that I've been fortunate to work with over the past year, and applying the lessons learned from the National Research Action Plan, which was a research initiative that occurred over the past 11 years and started with the Obama administration. And um, the capacity to take all that knowledge learned from DoD, from VA, from intramural and extramural research at all levels across basic science, translational science, implementation science around what does and does not work around characterization, diagnostics, treatment, and long term disposition. There's a great capacity to leverage AI at unique touch points there, right? So one would be the development of diagnostics. So potentially looking at biomarkers as an appropriate way to drive down beyond what historically has been, a concussion or MTBI, TBI, severe TBI classification scheme that might be based on imaging and some, clinical signs and symptoms. Actually having something that would allow for a, serum plasma based biomarker evaluation, similar to something like troponins, right? To look at severity of MI or just an infarct and other types of tissue and trend that over time. And then looking at the capacity for, changing a classification scheme to better reflect the actuality of the increased knowledge from pathophys and informing what the pathology is involved with the actual biochemistry of the pathways implicated in the development and persistence of TBI, and maybe the differential application of nuanced types of pathways that are in different age groups. So, with children, with adolescents, and then looking at aging populations and their capacity to bounce back from TBI, and then looking at the capacity for the um, distillation of lessons learned from large volume of data sets from patient records in the VA, looking at over 3 million records, right, to distill some lessons learned that oh, great. I'm seeing Sandeep Asur's mention here. It absolutely, yeah, that absolutely what I'm speaking to is, the capacity to take what previously was unused data or previously was thought not impossible, and develop these constructs and new frameworks that actually can do good to reframe the way an entire disease state is studied, right? So TBI is no longer an acute injury, right? It's a chronic disease process. It's something that is with you across the lifespan. And while there are improving capacity for diagnosis, for supportive care management. The last thing I think, and this might be an interesting one to finish on, is around that capacity to develop treatments at a more rapid pace based on high throughput screening that's leveraged by AI/ML informed platforms, and the capacity to say in 5 to 10 years we will have a treatment that's tailored for TBI,
Mhm.
which will help impact the downstream implications for, um, you know, quality of life, for years of productive life lost, for the implications of a TBI to an aging population, right? Because we are aging as a country. So I think that there's a numerous variety of these applications. And I just wanted to pull TBI as an example, as one that I've been working with and getting excited about. But hopefully that answers a little bit of the question, Linda.
Thank you so much. Gosh, thank you for the folks that are here asking these great questions. And thank you so much, Dr. States. I know you made the time to be here and participate. I appreciate your time so much. I also want to wrap up before LinkedIn disconnect everybody here. Do you have anything else that you would like to add before I close out, Dr. States?
The only thing I might say is a plug for folks that might be attending the AWS Summit next week. If you are attending on day 2, I'll be there, and I look forward to engaging with any of you that would like to chat.
Great, great. Thank you. So, as we wrap up today's event, we reflect on the transformative potential of AI in healthcare, from battling chronic diseases to addressing health inequalities. We've also discussed the ethical regulatory implications of integrating AI tools like chatbots. So, the path forward involving a balance act, which I guess with care and foresight, we can ensure humanity remains essential to this technological advancement. And remember, this is a stepping stone and it's an ongoing dialogue about AI and all of its possibilities. And so, thank you so much for joining us. And until next time, stay curious and continue innovating. Take care.